So again, the advantages of performing minimally invasive surgery rather than open abdominal surgery: we have significantly reduced blood loss compared to open surgery. We have much fewer complications. We have a shorter time in the hospital. We have a much faster recovery both in the hospital and once you leave the hospital, and much less scarring on the skin. So in terms of the different minimally invasive options, I touched on vaginal surgery. The advantage of vaginal surgery is that there is very little scarring because it's not performed through the skin, it's just performed through the vagina. It's a short hospital stay. It's usually about 2 days in the hospital versus an open surgery, which is usually 3 to 5 days in the hospital. And it is significantly less pain because you're not making that large abdominal incision. However, the drawbacks are that it is very difficult to perform. You're performing extensive surgery through a very small opening, so your assistants don't have a very good view of what's going on, and you don't have a lot of room for your instruments. So it also reduces your overall visualization because you can't always see very high up and you can't see the entire uterus. You can only see a small part of it at a time. And then it's just not feasible to do it in a lot of women. Women who have never gone through childbirth, it's often very difficult to perform vaginal surgery. People who have multiple fibroid tumors or large uteruses, it's very difficult to perform that surgery. If you have cancer, it's not really appropriate to do vaginal surgery in most cases. And if you've had a lot of prior surgeries, or if you have adhesions or scar tissue inside your abdomen, then it's very difficult to perform surgery vaginally. And even though it's much less pain compared to an abdominal surgery, there is still quite a significant amount of pain. So laparoscopic surgery is the next option we have in terms of minimally invasive surgery. And again, as you've seen earlier in some of the other presentations, the surgery is performed through really small incisions that are about the size of a dime. And it gives you much better visualization than open surgery in the sense that you can zoom that camera in really close, much closer than you can put your own eyes when you're doing these surgeries. So you can really get a much more detailed look at what you're seeing. But you can see some of the drawbacks of laparoscopic surgery. You've seen some of the earlier slides where you've seen all the monitors and the visualization you get with robotic surgery. With laparoscopic surgery, you have now this is an older slide, so our screens are a little bit bigger now. But again, you do see, you're operating here, but you're looking here while your hands are working down here, which from a hand-eye coordination point of view is very difficult to learn, very tiring, it leads to a lot of muscle soreness and fatigue. It's very difficult to perform complicated, long, extensive surgeries using this. And as you can see, you only have so much space where you can, each of us only has 2 arms. So you can't really add more assistants to get more instruments because there's no room for anyone else to stand there. So you're really limited in what you can do. So I, as the primary surgeon, can only handle 2 instruments, and I have to rely on other people to handle the other 2 instruments as well as to manipulate the camera where I want to go. So not only can I not use as many instruments as I want, but if I want to see a certain place, I can't just go to that place. I have to take that extra step of telling my assistant where to put the camera, where to look, waiting for that to happen, and then proceeding with the surgery. Some of the other drawbacks is that it is a 2-dimensional image, so from a hand-eye coordination point of view, and also assessing the size and the location of certain things that you're operating on, it is a lot more difficult than the 3-dimensional image you get with a robot. The instruments are rigid, so instead of all that manipulation you saw with the wrists of the robot instruments, you have a rigid fixed instrument that can only move up and down, left and right. And they're controlled at a distance. You're holding the instrument back here, and everything is the opposite of what you want. So if you want the instrument to go left, your hand has to go to the right. If you want the instrument to move up, your hand has to move down. So you're constantly forcing your brain to function in a way that's opposite of the way it wants to work. So all of that limits your dexterity, your precision, and your control. As I mentioned, there's a lot more surgeon fatigue with this because you're constantly moving your arms around in an uncomfortable position. And the amount of assistance that you can get is limited. So we've talked about how to overcome these drawbacks in some of the other lectures. And again, we're talking about the Da Vinci surgical system, which, as you've seen a few pictures before, you have 4 arms. Each arm has a very thin instrument on the end of it, and then the surgeon gets to sit in a very, very comfortable position where everything is ergonomic, everything's comfortable, and also in addition to that, in addition to what you have with the robot, you can still have that extra port to still have a second person as an assistant to have direct access to the surgery. So the vision system of the Da Vinci, when you're sitting at the console, this is what the system looks like. Your head rests right here comfortably on this cushion, and the eyes are looking through these two lenses, and then the hand controls are immediately below that here. So instead of looking at a monitor that might be 2 or 3 feet away, your eyes are looking directly into this field as if you were looking into an open surgical field standing above the patient. Except it's even closer because you can zoom that camera in much closer than you could with your own eyes in an open surgery. The other advantage of this vision system, which I don't think has been mentioned, is that with laparoscopic surgery, if you want to zoom in close, you have to move that camera in as close as you can, but that also obstructs your view because now you have a camera in front of you. The advantage of the Da Vinci system is, in addition to zooming in the camera by moving it in and out, it actually has what's known as digital zoom, which a lot of you probably have on your cameras, where the camera stays in place, but the computer technology actually blows up that image for you with that same resolution. So again, the surgeon directs the instruments by him or herself, and this is really important. When people hear the term robotic surgery, they're imagining sometimes, a separate entity that's doing the surgery, and perhaps the surgeon speaking into a microphone or typing instructions into a computer, and that's not the case. Everything you do with your hands is directly replicated with these instruments. So if I want to move this way with my instrument, I just move my hand this way. If I want to open and close scissors, I open and close scissors. It's not the opposite direction that you have to do with laparoscopic surgery. And again, you have wrist and finger movements with this. With traditional laparoscopic surgery, you have that rigid instrument that can only move like this. As you've seen in some of the previous videos, the wrist at the end of this instrument can actually move more than the human wrist can. The human wrist can only move 180 degrees. The robotic wrist is actually capable of rotating 540 degrees. So once you've reached the limit of your hand, you can actually reset the instrument, move your hand back, and rotate even further if you needed to. These instruments are very tiny. When we're doing open surgery, if you imagine a pair of kitchen scissors, that's about the size of the clamps and the instruments we use during open surgery, very large. With the robotic instruments, as you can see, these instruments are very tiny. So when we're doing a surgery, we're really being super precise about what exactly we're going after and minimizing the damage or potential damage to all the other surrounding areas. And they've really come up with a wide array of instruments, so any possible thing that needs to be done with the surgery really can be addressed by the instruments that are available. And as you can see, here's a dime here, and this is how large the instruments are compared to that dime. So that allows those really tiny incisions to be made. So again, I was mentioning the type of incisions involved. With gynecologic surgery, depending on the size of the condition you're going for, either you're looking at a large vertical incision where the skin, the muscle, and all those other layers are opened. A transverse incision, this is what you often see with C-section as well, where again, there's 5 different tissue layers that are opened individually and then have to be sewn together afterwards. Versus a Da Vinci surgery where you can have anywhere between 3 and 5 of these small dime-sized holes. So all of this taken together, what does that mean for the surgeon performing the operation? You have improved visualization, you have better control and precision with those instruments, you have better dexterity of what you can do with those instruments. Suturing is a lot faster, so when you're sewing with a needle, doing it laparoscopically is very difficult because, again, you can't move that wrist. And you can imagine when you're sewing with your hands, you're constantly moving and rotating your wrists. So that's why this is so much more adaptable to that. And better ergonomics as well. So what are the appropriate gynecologic conditions to treat with robotic surgery? Well, compared to conventional laparoscopy, there's things that laparoscopy cannot do that robotic surgery can. So very severe endometriosis, when there's a lot of scar tissue and things are severely stuck together, oftentimes we'll start a surgery where we start a laparoscopy, go inside with a camera, and realize right away that the surgery is just going to be too difficult and have to convert to an open surgery. You don't see that nearly as much with robotic surgery. When we put that camera in, we're not afraid to see all those things anymore. We know that with those robotic instruments, we can perform the same surgery as with the open surgery.